Hi, my name is Lauren Filler, and I am a freshman in the nursing school at the University of Michigan. I'm going to present a patient to you. History of present illness. Patient is a 53-year-old Caucasian male with a history of morbid obesity, COPD, asthma, and Hep C presenting with SOB, shortness of breath. He has never been married. His usual occupation is mechanic. Patient was originally in the ER for SOB 4 days ago. He was diagnosed with COPD exacerbation and treated with albuterol. After his symptoms improved, he was discharged home on prednisone. He returned to the ER 3 days later for SOB. He developed a cough productive of green sputum. When he coughed so hard, he passed out. In the ER, patient was wheezy and tachynic. His COPD began 4 years ago, but has gotten worse. He has been on breathing treatments and prednisone in the past. His present illness prevents him from walking or engaging in any physical activity. Physical activity aggravates his illness. Patient has a blood pressure of 139/82, a respiratory rate of 22 breaths per minute, an oxygen saturation of 96%, a temperature of 99.1 degrees Fahrenheit, and a pulse of 94 beats per minute. His health history. As a child, patient had weak bowel muscles and acid reflux. He has received the flu and pneumonia immunizations. He is allergic to horse serum proteins. Patient has had an appendectomy and a tonsillectomy in the past. He has also had surgery for a left quad tendon repair. Patient is currently taking a variety of medications. He takes citalopram for depression, prazosin for nightmares, trazodone for insomnia, an albuterol inhaler, acetaminophen, and ribavirin for Hep C. Functional assessment. Patient does no physical activity. He says that physical activity aggravates his COPD. He smokes regularly, but is attempting to quit because he was instructed to do so by his doctors. He takes meds to sleep, and without them, he cannot sleep at all. His nutritional intake is poor. He cannot cook because he cannot stand, so he orders in unhealthy foods often. Patient denies use of safety devices. Patient quit using heroin and cocaine 2 years ago. Patient lives with a roommate. Both his mother and father are dead. He has 2 brothers, but does not get along with either of them. He often fights with his brothers, which is a stressor. He is a high school graduate. Patient does not mention any spiritual practices. Family history. Patient's father suffered from COPD, AFib, and CVA. Patient's mother also suffered from COPD and lung cancer. Review of systems. Patient's perception of his general health is poor. He is aware of his poor nutritional health and obesity. Integument. Patient has a rash on his leg. He has burns on his stomach from grease. He experiences 3+ pitting edema on both legs and feet. No changes in his hair or nails. During the inspection, I noted no lesions or flaking on the scalp, normal hair distribution on head and body, normal gray color hair, no unusual body odor, paler skin color. I tested for turgor and found adequate moisture, normal skin temperature, normal nail shape and color, dry lower extremities and rash on legs, and a capillary refill of less than 3 seconds. Respiratory. Patient has shortness of breath, asthma, COPD, and a history of pneumonia. Patient produces sputum when he coughs, audible wheezes and crackles in lungs bilaterally. He experiences pain with breathing. During the inspection of his respiratory system, I noted normal color and thorax, a 2:1 AP diameter, a thorax symmetrical and has no deformities, trachea midline, rapid shallow breathing. I palpated normal expansion posteriorly, and I found crackles when auscultating bilaterally. I auscultated normal bronchophony posteriorly, auscultated normal echophony posteriorly, and auscultated normal whispered pectoralici posteriorly. 2 other systems that I would do are the peripheral vascular system and the abdominal system. For pertinent system number 1, the peripheral vascular system. Based on the patient's 3+ pitting edema on his feet, I chose peripheral vascular system as an additional system to focus on. He is not on any medications for his edema. Patient was diagnosed with this 5 days ago. The peripheral vascular system is also relevant to my patient because he experiences tenderness in his legs. According to Mayo Clinic, mild edema usually goes away on its own, particularly if you help things along by raising the affected limb higher than your heart. More severe edema may be treated with drugs that help your body expel excess fluid in the form of urine or diuretics. One of the most common diuretics is furosemide or Lasix. The second pertinent system that I would assess is abdominal system. Based on the patient's obesity, I would also assess the abdominal system. I would note the contour of his stomach as rounded or protruded. I would also note the burns on his stomach from grease. I might auscultate hyperactive bowel sounds because of his poor diet. Obesity can have many negative effects on other systems of the body. According to the American Heart Association, long-term longitudinal studies indicate that obesity not only relates to but independently predicts coronary atherosclerosis. This relation appears to exist for both men and women with minimal increase in BMI. This patient may face serious heart problems in the future.